Today we will learn how to access a venous port. This is Kelly, and she has already gathered her supplies, which is a port dressing change tray she obtained out of our Pyxis. She's also pre-assessed the patient's body habitus for the length of needle that she will use. The type of needle she'll be using is a non-coring 90-degree needle. She will allow that chlorhexidine to dry at least 30 seconds and possibly up to 3 minutes. She will now lay her fenestrated drape down properly. As you see on the drape, it has numbers on it, and you will point those numbers towards the patient's head. They do have adhesive tabs on the back, and you will pull half of that tab off, and those will stick to the patient's chest. She's opening up her fenestrated drape that will cover the patient's gown and bed linen. So now you have a sterile field encumbering your patient. Her port needle has already been pre-primed, and she has already physically palpated her port dome. She will maintain her syringe sterility as she takes her left hand and grasp it around the port. She will come in at a 90-degree angle with her non-coring needle. She'll ask the patient to take a big deep breath in and blow in as they penetrate the diaphragm. She will now put her syringe in her right hand and reverse her plunger to see if we have blood return. And for this video, we are going to pretend that we have blood return, brisk blood return. Then she will aspirate 3 to 5 more mLs, and she'll waste that. And then we will, if this is at the time that we will develop or we will obtain a blood sample. But Kelly today doesn't need a blood sample. So now she's just going to change her syringe and get another syringe out of the cellophane package. And she's going to flush again. At this time, Kelly does not have to alcohol that needleless connector because it is sterile.
Go ahead and flush.
Go ahead and flush. And then half of it. Kelly's not going to use the whole syringe to flush because Chester just really can't tolerate it. The next thing we're going to do is apply skin prep that is in your kit. And we will put that on the outer edges, not allowing it to get around the insertion site. As this will dry completely, Kelly will apply her biopatch. Sometimes it's often easier if you squish your biopatch in between your fingers, making it wafer thin. The most important part about the biopatch is once she gets it under the port needle around the insertion site, that the edges of it need to come back to be well approximated.
Sticky.
Excellent job. The next thing, we will apply our dressing. We will just do one paper removal at a time, Kelly. We'll do one side and do the bottom. next thing that Kelly will apply is the securement section. And sometimes we forget to put this, but it's very important to stabilize the extension set. And as you see, Kelly is removing one side at a time for better adherence and less puckering of the dressing. And what came in Kelly's port needle kit is a label that she will finish up labeling not just the dressing, but she will also independently label the port needle. So that's 2 labels, one on the dressing, one on the needle. And we'd like to thank you all very much. If you have any questions, please feel free to call Gina Stevenson at 4083 or Joey DeSico at 3972, or the Vascular Access Specialist team, which is 3055. Thank you.